So if you think there was a mistake, then go talk to the federal government. It's not about pointing fingers or blame. Look, whether a person died in a hospital or died in a nursing home, it's the people died.
That's New York Governor Andrew Cuomo. He's trying to turn the attention back on the Trump administration's record in response to a new situation here in New York State. That has to do with the New York State Attorney General's report that the Cuomo Health Department underreported nursing home coronavirus deaths and did that by as much as 50%. You know, critics have accused the governor of purposely engaging in an effort to try and hide the true numbers of those who died in nursing homes. He and his administration, though, as you heard, say that they followed the law and federal guidelines for readmittance of COVID patients and other people to nursing homes. And he says the criticism is political and, quote, ugly. New York State Republican Assemblyman Kevin Byrne joins us. He's been leading the legislative attempt to delve into all this. He's the ranking member of the Assembly Health Committee. Assemblyman, thank you for joining us. Do you think this was a Cuomo cover-up or just an oversight?
Well, thank you for having me, Eric. I would say first and foremost, we've been asking for this data for months. So certainly they've withheld it not only from the public, but from their elected representatives in the state legislature. We have an obligation to pass policies that protect public health and safety. We know that there was a very controversial March 25th directive from the Department of Health. Many of us wanted answers to see what that effect had on our nursing home residents. And now we're finally getting some answers from Attorney General Tish James's report. And we're getting some information from the Department of Health, but still not what we need. They gave us a total for the year from March of last year till January, but we don't know when or where those deaths occurred to actually have this information. So they're still hiding this information. They're not sharing it with the legislators. It's public data. They need to share it with us. That's why I've joined with a bipartisan effort with Ron Kim, an assemblyman from the city. He's the chair of the Aging Committee, appealing to President Biden. We've previously appealed to President Trump to compel the CDC to apply retrospective reporting to make sure this data is public. At this point,
why would they, as you say, not want to? Why would they not want to release it if it's public information?
Well, as we've seen from the breaking stories in the last couple of days, doesn't make New York look very good. It doesn't fit the narrative that most of the media have been putting out there about the governor in the state of New York handling COVID-19 in nursing homes. You know, we have one of the highest death totals of any state in the nation, and it's tragic and it's awful. But what we were being told was earlier in the summer, it was over 6,000 deaths. Then it was just about a week ago, it was a little over 8,000 deaths. Now we're looking at it, it's nearly 13,000 deaths. That's a giant jump because they weren't publicly disclosing the number of COVID-19 patients that died that contracted the virus from nursing homes.
You know what the governor says. I mean, sorry to interrupt. It's hard in this new system, but you know what the governor says about this? That one, you know, he was following federal guidelines. That the nursing homes were supposed to be able to take care of people with coronavirus and/or prevent the spread of coronavirus. So, in his view, I guess he doesn't see that he did anything wrong. But you mentioned that March 25th directive. Tell us about that.
Well, we know the March 25th directive did two things: a very strongly worded language, using words like must, shall, prohibit, prevented any nursing home from denying COVID-19 positive patients. It also prohibited them from requiring tests. Some other states had similar orders, but I don't think anyone with any common sense thinks putting COVID positive patients into nursing homes, particularly if they're ill-equipped, is a good idea. And for him to suggest the federal government is saying that it's consistent with their guidelines, that's just not true. We know that CMS Administrator Seema Verma pushed back against that. PolitiFact said that was mostly false. The Department of Health and Human Services has pushed back against that. The governor owns this. And earlier during the pandemic in his press briefings, he talked about being truthful with the New Yorkers and American people. Give us the facts. That's all we've been asking for. Be truthful with us. You hid this information from us for the last several months. How are we supposed to do our jobs? And these families that lost loved ones deserve answers. And we need to make sure that this never, ever happens again. And if people did cover this up, Eric, if they willfully covered up information that could have prevented death and destruction in our nursing homes, we need to have them exposed, and we need to hold them accountable.
Yeah, you just mentioned, those briefings. They were a great comfort to a great many New Yorkers and others across the country. But now some are seeing it in a different light. Let's just take a look and I'll get your reaction on the other side.
Don't criticize the state for following the president's policy. The nursing home said, we can take that person. They will all say, don't leave a person in a hospital for 2 weeks. We are number 35th in the nation in percentage of deaths in nursing homes. Go talk to 34 other states first. We've done a full study of it. The virus came into nursing homes from the staff. There was never a directive that said we will send COVID-positive people back to nursing homes.
Your response to his pointed defense?
The directive was clear. The language was clear. If it's something he stands by, continues to stand by, we still want to know why it was just randomly removed from the Department of Health website. He continues to shift blame and try to point fingers. He's quite good at that. He needs to take more accountability. The families that lost loved ones deserve that. And, he uses this statistic, Eric, about percentage of total deaths. It's a misleading statistic because we're the highest total death counts of any state in the country. The reality is, if you look at the death count for those who lost their lives from contracting this virus in nursing homes, based on the information we just received from the Attorney General, we're among the highest in the nation. That's what people should be looking at, not at the percentage.
Kevin Byrne, a New York State Assemblyman who has a background in health management, by the way, and is the ranking member of the Health Committee, trying to get some answers. Assemblyman, good to see you. Thank you for joining us this afternoon.
Thank you, Eric.